Hello and welcome back. My name is Dr. Alan, and today we are going to talk about highly contagious illness that many of us remember from childhood, chickenpox, also known as varicella. While it's often seen as a childhood illness, chickenpox can have serious consequences, particularly in vulnerable populations. In this video, I will walk you through everything you need to know, from what causes it and how it spreads, its symptoms, complications, and prevention strategies. Let's dive in. Chickenpox is an acute, highly contagious viral infection caused by the Varicella zoster virus. It typically causes a widespread itchy skin rash along with fever, fatigue, and general discomfort. While generally mild in children, it can lead to serious illness in adults, pregnant women, and individuals with weakened immune systems. Recognizing how this disease affects different populations is essential for proper prevention and care. Before vaccines became available, chickenpox was nearly universal in childhood. In the United States, it caused around 4 million cases, 10,000 hospitalizations, and 100 to 150 deaths each year. Since the introduction of the Varicella vaccine in 1995, cases have dropped by over 90%. Despite this progress, chickenpox remains a public health issue in regions where vaccination is not routinely practiced. In many developing countries, it continues to result in high morbidity and mortality, especially among vulnerable populations such as malnourished children. Chickenpox is caused by the Varicella zoster virus, a double-stranded DNA virus that belongs to the herpes virus family. What makes this virus unique is that after the primary infection, it stays dormant in the body's nerve tissues. Years later, it can reactivate as shingles, also known as herpes zoster, causing painful and localized rashes. This reactivation is more common in older adults and immunocompromised individuals. Chickenpox spreads primarily through airborne respiratory droplets when an infected person coughs or sneezes. Direct contact with the fluid from the blisters or vesicles. A person with chickenpox is contagious from 1 to 2 days before the rash appears until all lesions have crusted over. Because of its ease of transmission, chickenpox spreads rapidly in schools, households, and daycare centers. In fact, it's estimated that up to 90% of susceptible household contact will become infected. Now, let's talk about the incubation period. The incubation period of chickenpox is the time between exposure and the onset of symptoms, and it is typically 10 to 21 days, with an average of 14 to 16 days. During this time, the virus is silently multiplying in the host body. This asymptomatic phase makes early detection difficult and facilitates unintentional spread, particularly in group settings. 1 to 2 days before the rash appears, early signs of chickenpox may include low grade fever, loss of appetite, fatigue or irritability, headaches, and malaise. Because these symptoms are general and resemble other viral infections, the disease often goes unrecognized until the rash appears. The hallmark of chickenpox is a widespread itchy rash that progresses through four distinct stages. First one is the macules, small flat red spots. Second one is the papules, raised red bumps. Third one is the vesicles, fluid-filled blisters. And the fourth one is the crust, blisters that have dried and scabed over. The rash typically begins on the face, chest, and back, then spread to the arms, legs, and inside the mouth or other mucous membranes. What's unique about the chickenpox is that all four rash stages can appear simultaneously on different parts of the body. Scratching the rash can lead to secondary bacterial infections, scarring, and prolonged recovery. Although chickenpox is usually self limiting, it can lead to serious complications, especially in high risk groups. Some common and severe complications include bacterial skin infections, such as cellulitis or impetigo, pneumonia, particularly in adults and pregnant women, encephalitis, or inflammation of the brain, which can lead to seizures, hepatitis, especially in immunocompromised patients, and in some cases, it can cause Rash syndrome, a potentially fatal condition linked to aspirin use in children. Chickenpox is usually diagnosed clinically based on the distinctive appearance of the rash and accompanying symptoms. However, when the diagnosis is uncertain or complications arise, laboratory confirmation can be useful. Diagnostic tests include PCR or polymerase chain reaction, the most sensitive test to detect viral DNA, and direct fluorescent antibody testing, used to visualize the virus, and serologic test, measures IgM and IgG antibodies to confirm recent or past infection. Timely diagnosis is important not only for proper treatment but also for public health notification and outbreak control. For most healthy children, chickenpox resolves on its own with supportive care, including antihistamines or calamine lotion to relieve itching, paracetamol or acetaminophen to reduce fever, hydration and plenty of rest. In high risk individuals, antiviral medications like acyclovir may be prescribed. These are the most effective when started within the first 24 to 48 hours of symptom onset. Early antiviral treatment can reduce the severity and duration of symptoms, especially in adults and immunocompromised patients. Certain groups are more vulnerable to severe chickenpox: newborns and infants under 1 year, pregnant women, unvaccinated adolescents, and adults. In these cases, post exposure prophylaxis may be recommended, including the use of the Varicella zoster immune globulin or antivirals. Early intervention is key to preventing severe outcomes. Vaccination remains the most effective strategy to prevent chickenpox. The Varicella vaccine is a live attenuated vaccine given in two doses. First dose 12 to 15 months of age and second dose is 4 to 6 years of age. It provides 90 to 95% protection against infection. In addition to preventing chickenpox, the vaccine also reduces the future risk of developing shingles. Post exposure vaccination within 3 to 5 days can still prevent or lessen the severity of the disease. Chickenpox can resemble other illnesses, making diagnosis challenging, such as measles. Start with fever, cough, and conjunctivitis before rash, hand, foot, and mouth disease. Rash primarily on hands, feet, and mouth, and it can resemble with shingles. Same virus causes painful rash in a localized area. Accurate diagnosis ensures proper treatment and prevent unnecessary complications or transmission. Chickenpox is a preventable and controllable disease. Widespread vaccination reduces outbreaks and protects individuals who cannot be vaccinated through herd immunity. Healthcare professionals and public health officials must prioritize awareness, access to vaccination, and proper education. To recap, chickenpox is a common but potentially serious viral illness. Although most recover without complications, some groups face greater risk. Supportive care and early antiviral use help manage symptoms, while vaccination is the best preventive tool. Understanding chickenpox empowers communities to respond better and stay protected. That's it for today. Thanks for watching. I will see you in the next lesson.